Welcome to today's discussion on tuberculosis in orthopedics. In this video, we'll delve into the causes, symptoms, signs, investigations, treatment strategies, and referral criteria for this condition. We'll also review some USMLE-style questions to solidify your understanding. USMLE-style questions. Question 1. A 7-year-old child presents with swelling and pain in the knee, along with a history of night sweats and weight loss. What is the most likely diagnosis? Answer: tuberculosis of the knee joint. Explanation: the symptoms of joint swelling, pain, night sweats, and weight loss are indicative of tuberculosis affecting the knee joint, especially in the presence of systemic symptoms like night sweats and weight loss. Question 2. Which bacteria are most commonly responsible for musculoskeletal tuberculosis? Answer: Mycobacterium tuberculosis, Mycobacterium africanum, Mycobacterium bovis. Explanation: these bacteria are the primary pathogens causing tuberculosis, including musculoskeletal involvement. Question 3. What is the most common site of involvement in skeletal tuberculosis? Answer: the spine. Explanation: approximately 50% of musculoskeletal tuberculosis cases involve the spine, making it the most commonly affected site. Question 4. What is the primary objective of physiotherapy in patients with joint tuberculosis? Answer: to maintain joint mobility and muscle strength. Explanation: physiotherapy aims to prevent joint stiffness and muscle wasting, which are common complications in patients with tuberculosis of the joints. Question 5. What is the typical duration of antitubercular treatment for bone and joint TB? A. 4 weeks. B. 2 to 3 months. C. 6 to 12 months. D. Lifetime. Answer: C. 6 to 12 months. Explanation: bone and joint tuberculosis requires prolonged treatment with antitubercular medications, usually for 6 to 12 months, to ensure the eradication of the infection. Tuberculosis in orthopedics. Tuberculosis, TB, can affect any bone and joint, with the spine being involved in about 50% of cases. It can occur at any age but is more prevalent in young children and the elderly. TB of the bones and joints may coexist with pulmonary TB, particularly in HIV-positive individuals, making early detection and management crucial. Causes. Mycobacterium tuberculosis, the primary causative organism in most cases of tuberculosis. Mycobacterium africanum, a variant that can also cause TB, particularly in Africa. Mycobacterium bovis, less common, but can cause TB, especially in settings where bovine TB is prevalent. Symptoms. Pain, especially at night, a hallmark symptom of bone and joint tuberculosis. Swelling, affected joints may appear swollen due to inflammation or abscess formation. Deformity, chronic infection can lead to deformities, particularly in weight-bearing joints. Night sweats, common in systemic TB infections. Low-grade fever, persistent mild fever often accompanies TB. Chronic cough, indicates possible coexistent pulmonary TB. Weight loss, a sign of systemic illness and chronic infection. Signs. Swelling, visible or palpable enlargement of the affected joint or bone. Tenderness, pain on palpation of the affected area. Deformities, structural changes due to prolonged infection and inflammation. Discharging sinuses, openings in the skin that drain pus, typical in advanced cases. Cold abscesses, abscesses that are not associated with warmth or redness, characteristic of TB. Muscle wasting, loss of muscle mass around the affected area due to disuse. Investigations. Chest X-ray, to check for concurrent pulmonary TB. X-ray of the affected part, helps identify bone destruction or joint space narrowing. Sputum or gastric washings for acid-fast bacilli, AFBs, to detect TB bacteria. full blood count, FBC, erythrocyte sedimentation rate, ESR. Elevated ESR is common in TB infections. MRI of the affected areas, if available, provides detailed imaging of soft tissue and bone involvement. Bone and soft tissue biopsy for culture and histology confirms TB diagnosis and determines drug sensitivity. Mantoux test, a tuberculin skin test to check for TB exposure. Treatment. Treatment objectives: eradicate the infection, achieve complete elimination of Mycobacterium. Prevent and correct deformity, early intervention to avoid long-term structural damage. Prevent joint stiffness, maintain joint function through appropriate therapy. Non-pharmacological treatment. Physiotherapy, to maintain joint mobility and muscle strength, preventing stiffness. Use of splints, corsets, or body jackets, provides support and immobilization to prevent further damage. Drainage of abscesses, surgical drainage may be necessary to remove infected fluid. Surgical debridement, removal of infected or necrotic tissue to control infection. Arthrodesis, joint fusion considered in cases of severe joint destruction to relieve pain and maintain function. Pharmacological treatment. For bone and joint tuberculosis. Follow standard TB treatment protocols, typically involving a combination of antitubercular drugs such as isoniazid, rifampicin, pyrazinamide, ethambutol. Treatment duration is usually 6 to 12 months, tailored by a specialist based on the severity of the disease. For pain relief. NSAIDs like ibuprofen or paracetamol can be used. Ibuprofen, 200 to 400 mg every 6 to 8 hours as needed, not exceeding 2.4 g daily. Paracetamol, 500 mg to 1 g every 4 to 6 hours, not exceeding 4 g daily. Referral criteria. Refer to an orthopedic surgeon, infectious disease specialist, or rheumatologist, as soon as the diagnosis of TB is made. Comprehensive management and follow-up are essential to prevent complications and ensure effective treatment. Tuberculosis in orthopedics. Tuberculosis, TB, can affect all bones and joints, with the spine being involved in approximately 50% of cases. It can occur at any age but is more common at the extremes of age. TB of the bones and joints may coexist with pulmonary TB, especially in individuals who are HIV positive. There may be a positive history of contact with a TB-infected individual. Causes: Mycobacterium tuberculosis, Mycobacterium africanum, Mycobacterium bovis. Symptoms: pain, especially at night, swelling, deformity, night sweats, low-grade fever, chronic cough, weight loss. Signs: swelling, tenderness, deformities, discharging sinuses, cold abscesses, muscle wasting. Investigations: chest X-ray to rule out pulmonary TB, X-ray of the affected part, sputum or gastric washings for acid-fast bacilli, AFBs, full blood count, FBC, erythrocyte sedimentation rate, ESR. MRI of the affected areas, if available. Bone and soft tissue biopsy for culture and histology. Mantoux test. Treatment. Treatment objectives: eradicate the infection. Prevent and correct deformity. Prevent joint stiffness. Non-pharmacological treatment. Physiotherapy to maintain joint mobility and muscle strength. Use of splints, corsets, or body jackets to support affected areas. Drainage of abscesses as needed. Surgical debridement of infected tissues. Arthrodesis, joint fusion, in cases of severe joint destruction. Pharmacological treatment. For bone and joint tuberculosis. Treatment should follow the standard TB treatment protocols, which typically include a combination of antitubercular medications such as isoniazid, rifampicin, pyrazinamide, and ethambutol for an extended duration, usually 6 to 12 months. Dosage and duration should be guided by a specialist. B. For pain relief. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or paracetamol can be used to manage pain. Ibuprofen, adults, 200 to 400 mg every 6 to 8 hours as needed, not exceeding 2.4 g daily. Paracetamol, adults, 500 mg to 1 g every 4 to 6 hours, not exceeding 4 g daily. Referral criteria. Refer to an appropriate specialist, orthopedic surgeon, infectious disease specialist, or rheumatologist, as soon as the diagnosis is made for comprehensive management and follow-up. Tuberculosis in orthopedics is a serious condition that requires timely diagnosis and aggressive treatment to prevent disability and complications. Awareness of the signs and symptoms, along with proper investigation and management strategies, is key to successful outcomes. If you found this video helpful, don't forget to like, comment, and subscribe for more medical content.